Frankfurt University Hospital. If patients come here with thyroid nodules, surgery is a last resort. Other options are exhausted first, like radiofrequency ablation, for example, a method that employs heat to destroy the lumps. This therapy can be used with what are known as hot nodules, which are almost always benign and often linked to a hyperactive thyroid. If there's no sign of cancer, it can also be used to treat what are called cold nodules, unexpected harmless changes in thyroid tissue. Soraya Reeling has had a benign cold nodule for many years. The specialist introduces an ultrasound probe into the nodule through a tiny incision. High-frequency electricity delivered through this needle heats up the nodule and destroys it.
The
electricity is generated by this device and released in the eye of the needle, where both electrodes are located. That warms the spot to 60 or 80 degrees Celsius. That's enough to kill the diseased tissue.
The dead tissue is eventually reabsorbed by the body. The patient is surprised that it didn't hurt more. Almost all operations like this are painless. The procedure only takes about 20 minutes. In most cases, a single session is enough.
You can see from the ultrasound that the gas bubbles have spread all over the nodule. They're a sign of more warmth, of heat. They play a role in destroying the nodule.
But it will take weeks for the nodule to shrink and finally disappear. Natalia Kresnik underwent radiofrequency treatment 9 months ago. She's come for an ultrasound scan today. Endocrinologist Frank Grünwald examines how much of the diseased thyroid tissue has disappeared.
I'm very satisfied. The nodule has shrunk by 75%. All is going as planned. You don't need to take any medication. Just eat normally, not too much iodine, and keep having regular ultrasound scans and lab tests.
It's important to seek advice from doctors about alternatives to removing the thyroid. Other minimally intrusive methods include microwave ablation and surgery using ultrasound or lasers. Radioactive iodine treatment is also an option.
In radioactive iodine treatment, patients swallow a radioactive capsule that dissolves in the stomach. The substance goes into the blood and is absorbed by the diseased tissue. The tissue is then destroyed over the next weeks and months.
Specialists avoid treating young people with the radioactive therapy. Natalia Kresnik is glad that radiofrequency ablation helped her avoid an operation.
I would have had a big scar, and I would have had to take medication my whole life. Now I'm fine. You can't see the nodule or any other traces of the procedure. It's much better than an operation.
Since a malfunctioning thyroid can often be treated by hormones, heat, or radiotherapy, fewer and fewer doctors are resorting to the scalpel.